Being insured does not always mean that you have access to affordable, sufficient care. When you enroll in a health insurance plan, the expectation is that you will have a sufficient number of providers, that you will have timely access to care, and that the time that you take to travel to a doctor's office will be reasonable. This is what is referred to as network adequacy. So network adequacy is a really big issue for consumers today because as more and more Georgians become insured, they want to ensure that the plans that they pay premiums for are adequate. There are ways to actually measure the adequacy of a provider network. They include the amount of time that it takes to access urgent care, the amount of time that it takes to get an appointment at your doctor's office. These are ways that we can figure out if a network is sufficient, if it's too broad, or if it's too narrow. The issue is that the current existing standards for measuring whether or not a network is adequate are very broad, and they're very insufficient in measuring whether or not consumers have the access to the needed care. Georgia actually has an opportunity to fix this problem through state legislation. So we at Georgians for a Healthy Future are recommending that the state consider setting more clearly defined access to care standards. These standards could include things such as travel distance times for urban and rural areas. They could include the amount of time that they deem reasonable for a patient to wait for an appointment. We believe that establishing a strong baseline of standards will ensure that all consumers have access to reasonable covered services and that all health plans are operating under a fair set of rules.